to ensure that the state of Texas and our cities and counties are fully capable to prepare and respond to COVID-19, I am, at this moment, declaring a state disaster for all counties in the state of Texas. This will authorize the use of all available and necessary state government resources to help prepare and respond to COVID-19. Now, the state has also asked health insurers and HMOs operating in Texas to waive costs associated with the testing and telemedicine visits concerning coronavirus. If an uninsured person needs testing for coronavirus, there are two options. One is public health testing or private laboratory testing. For public health testing, it requires consultation with local health departments. If the person meets public health criteria, then the person is eligible for testing through public health testing with no cost to the person. Private testing can also occur, but there could be a cost to the individual. If people need to find a local provider, they can call 211, which can direct them to low or no-cost providers in their area. I'm pleased to announce that Mayor Nirenberg in the city of San Antonio and his team are opening the first drive-through testing facility in Texas. My team is also working with the cities of San Antonio and Dallas and is in conversation with the city of Austin to also implement drive-through testing sites that will also be run and managed at the local level. A key focus in our response is to prioritize protecting of the most vulnerable populations who would be most likely to contract COVID-19. As a result, I am directing state agencies to restrict visitation at nursing homes, state-sponsored living centers, hospitals, and daycares. This directive allows limited exceptions for things like end-of-life visitation and requires all individuals to go through the proper screening. We want to make sure that we do all we can to prevent this vulnerable senior population or others in hospitals from being contracted with COVID-19. I'm also directing state agencies to restrict visitation at prisons, jails, and juvenile justice facilities. My staff remains in constant contact with all of those facilities as they work on establishing best practices protocols. I'm also directing state agencies to take any action necessary to facilitate telemedicine. In addition, I'm directing state agencies to provide flexible work and telework policies to employees to give them the ability to care for their families while ensuring the state government continues to function at full capacity and provide all necessary services. This means, in addition, that anybody who thinks or feels or believes that they are ill in any way, they need to stay home and work from home. You may have the flu, you may have some other infectious disease, or you may have COVID-19. We don't need people who are sick coming into work. As far as Texas schools are concerned, Texas is seeking waivers for federal regulations for the school lunch program to give districts flexibility to provide students food should the district need to shut down for a temporary period to respond to the coronavirus. There's absolutely no need to go out and stockpile supplies. We've been working with grocers and retailers, and Texans must remain calm and understand that hoarding is neither necessary nor productive. We are prepared with the goods and supplies we need. Now, one byproduct of having more people work from home, whether it be people who are working or whether it be students who may be in a school that would be temporary closed or college or university, that it will increase demands upon the internet bandwidth. I applaud what AT&T just announced, that they are waiving internet data usages for any customer who does not have unlimited home internet access. Now, the state of Texas will continue to take preventative measures and work with our federal and local partners to contain this virus and to keep Texans safe. During this time, we need all Texans to do their part to help the state respond to this situation. That means doing things like being extra vigilant about washing your hands, disinfecting frequent touches, avoid shaking hands, and staying at home if you're feeling sick. I want to assure the people of Texas that we're going to make it through this. We've been through situations like this before. We made it through SARS, we made it through Ebola, we made it through H1N1, and we're going to make it through this together as well. If you'll remember, on February the 7th, Lackland Air Force Base in San Antonio received 90 repatriations of American citizens from Hubei province in China. Among those 90, one of the people tested positive, but has since been cleared. Importantly, all 90 of those people have now returned home. This is not a death sentence we're dealing with here. This is a typical outcome that we expect to see. Working together, I know that we can do it.